So the next question is, what are dense breasts? We keep throwing that term around, and what does it really mean? Well, breast tissue is essentially two types, fatty or non-dense, and then the connective tissue, which is considered the dense tissue. The connective tissue includes ducts and lobules. You may hear it referred to as fibroglandular or glandular tissue. And breast density is determined by mammogram, not by feel, not by the size of the breast or the firmness of the breast. In fact, there are some women with what feels like lumpy, bumpy breasts that are actually not at all dense on mammography and imaging. And a grading scale is used by breast imagers to determine the 4 categories of breast density. And they are as follows. So category 1 means that the breast tissue is mostly fatty. Category 2 is that the tissue is mostly fatty with a few scattered areas of dense tissue. Category 3 is that the tissue is heterogeneous and usually a consistent mix of dense and fatty tissue. And category 4 is identified when the breast is mostly dense. Dense breast tissue can sometimes hide, mask, or overshadow cancer. And in women who have dense breasts, 3D mammograms are especially useful. Interestingly, reporting on density of breast tissue only started in 2009 and has slowly been made into state law, and this has been very gradual. There's actually a federal law requiring reporting about breast density, but only 44 states currently have laws in effect to send this information directly to the patient. That said, of the 44 states, where only there are some states where they just need to notify the patient a general notification that there's such a thing as breast density and that may affect their ability to find breast cancer. And then there are other states where a woman is actually informed about her specific breast density. So unfortunately, there are still a lot of inconsistencies with the way that this reporting is done and the way that it's given to patients.